Imagine this: one day, you're on top of the world, feeling unstoppable. Then, suddenly, without warning, you plunge into a dark, low space that seems impossible to climb out of. This is a glimpse into the experience of living with bipolar disorder. If you or someone you love is dealing with bipolar disorder, understanding the triggers that set off these intense mood swings can make a world of difference. What is bipolar disorder? Bipolar disorder is a mental health condition that causes extreme shifts in mood, energy, and activity levels. Some people experience manic episodes, where they feel abnormally high and euphoric, while others may sink into depressive episodes, where they feel deeply sad and low. The ups and downs can feel overwhelming and uncontrollable, but there are ways to manage them. The key? Recognizing and understanding the potential triggers that may cause these shifts. 1. Stress, the invisible trigger. Stress is one of the most common triggers for mood episodes in people with bipolar disorder. Stress isn't just about big life events, it can also include everyday challenges like work deadlines, family conflicts, or even financial worries. In the context of bipolar disorder, stress can feel like a ticking time bomb, just waiting to set off a manic or depressive episode. Examples of stressful life events: losing a loved one, going through a breakup or divorce, experiencing job loss or financial difficulties, coping with natural disasters, or sudden changes. Studies show that stress has the biggest impact on individuals with bipolar I disorder, which is characterized by more intense manic and depressive episodes. Recognizing stressors and learning ways to cope can reduce the risk of triggering a mood episode. 2. Sleep disruptions, the unexpected connection. There's a powerful link between sleep and bipolar disorder. Not only can bipolar disorder disrupt sleep, but poor sleep habits can trigger mood episodes, especially mania. This connection is often stronger in people with bipolar I disorder and tends to impact women more than men. What disrupts sleep? Mood disorders, pregnancy or hormonal changes, pain or chronic illnesses, shift work and irregular schedules. A 2017 study even found that women were more than 1.4 times more likely to experience mania due to lack of sleep. A simple change in sleep patterns can throw the brain's delicate chemistry off balance, potentially triggering an episode. 3. Seasonal changes, more than just a weather pattern. For around 1 in 4 people with bipolar disorder, seasonal changes can influence their mood. People with both bipolar disorder and seasonal affective disorder, SAD, may feel more depressed during the fall and winter months when daylight decreases, while mania may be more common in the spring and summer when light levels increase. Beyond the seasons. Beyond just seasonal changes, people with bipolar disorder can also be sensitive to other weather-related factors like temperature, rainfall, and even barometric pressure. It's a reminder that, for many, mood shifts are deeply tied to the environment around them. 4. Hormonal changes, the internal roller coaster. Hormones play a significant role in bipolar disorder, and changes can trigger mood episodes. For instance, women may experience more intense bipolar symptoms around their menstrual cycles, during pregnancy, or in menopause. Men may also see mood shifts due to hormonal changes, although less research has been done on this. Hormones and brain chemistry are intricately connected, and for those with bipolar disorder, even slight fluctuations can affect their moods. If you or someone you know is noticing patterns related to hormonal changes, tracking these alongside moods can provide valuable insight. 5. Medications and substances, the chemical imbalance. Certain medications and even some herbal supplements can trigger mood shifts in people with bipolar disorder. For example, antidepressants, while often necessary, can sometimes cause mania, which is why doctors will often prescribe mood stabilizers along with them. Corticosteroids, often used for inflammation, can also trigger manic symptoms when started and depressive symptoms when stopped. Substances to watch out for. St. John's wort, acid, L-carnitine, caffeine, alcohol and recreational drugs. Substance use disorder, SUD, is unfortunately common among people with bipolar disorder, affecting up to 50%. This dual diagnosis can increase the risk of mood episodes as these substances interfere with the brain's chemical balance. The effects are unpredictable and can lead to heightened mood swings. Managing bipolar disorder mood episodes. Even though bipolar disorder is a lifelong condition, proactive management strategies can reduce the frequency and intensity of mood episodes. Here are some self-care practices to consider. Managing manic episodes. Set a regular sleep schedule. Try to go to bed at the same time every night, even if you don't feel tired. Avoid stimulants, skip caffeine and alcohol, as these can worsen manic symptoms. Seek calm environments. Choose places that help you relax, avoiding situations where you might take risks, like driving or gambling. Delay major decisions. Avoid making big life choices when in a manic episode to prevent impulsive actions. Managing depressive episodes. Prepare easy meals. Have ready-made meals on hand, as cooking might feel overwhelming. Stick to a basic routine. Keeping a simple schedule can provide structure and help you feel grounded. Try gentle activities. Exercise like yoga or walking in nature can improve mood. Reach out for support. Talk to friends or family members, and consider joining a support group or speaking with a therapist. It's also crucial to have a plan for when episodes begin to emerge. Writing down your triggers and strategies and sharing them with loved ones can help everyone stay on the same page. Remember, bipolar disorder affects each person differently. Finding what works best for you might take time, but it's worth the effort. The importance of medical support. Episodes can sometimes occur without any identifiable trigger, which is why it's essential to have a treatment plan that includes regular contact with a healthcare provider. If medications aren't effective or cause side effects, speak with a doctor rather than stopping them on your own. Adjustments to treatment can make a significant difference. Final thoughts. While living with bipolar disorder can be challenging, understanding your triggers and developing coping strategies can empower you to take charge of your mental health. Mood episodes may still happen, but they don't have to define you. Take it one day at a time, lean on your support network, and remember, you're not alone. With the right tools and support, it's possible to navigate bipolar disorder and live a fulfilling life.